kids not to stick the book up their nose, and you'll be fine.
Good afternoon. It is now 4:34, and I will call the Board of Health meeting to order. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks. Okay, now I'll get into the potatoes. So I just have to read this little update. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 20, and the Governor's executive orders imposing strict limitations on the number of people that may gather in one place, although a quorum of the members of the Dudley Board of Health will be physically present at this meeting, no in-person attendance of members of the public will be permitted. Oh boy, it's a rough day. The meeting will be live broadcast on Dudley Cable Access, and members of the public can also view the meeting via YouTube. Members of the public who wish to appear before the Board of Health must make an appointment to appear on an upcoming agenda by contacting, we'll be switching that over to Michelle at 508-949-8012 and at building@dudleyma.gov. Placement on the agenda is not guaranteed, however, and persons requesting to appear before the Board of Health should not attend a meeting in person unless and until the appointment has been confirmed by the Board of Health. Persons with matters appearing on a meeting agenda may request that they attend via virtual means rather than via in person. Such requests should be directed to Michelle at 508-949-8012 or building@dudleyma.gov no more than 72 hours, not counting Saturdays, Sundays, or legal holidays in advance so that appropriate arrangements can be made. However, persons or representatives with matters appearing on the meeting notice agenda who wish to be physically present at the meeting must observe the following requirements. In accordance with existing requirement imposed by the Governor, meeting rooms will be limited in terms of the total number of persons that may physically present at the same time, including board members and staff. Satellite rooms will be available for overflow, and the meeting will be broadcast in real time in those satellite rooms. Persons who wish to participate in any particular matter on the meeting agenda will be asked to wait in a satellite room until that agenda item is reached, at which point attendees will be rotated between the main meeting room and the satellite rooms as appropriate. Social distancing must be maintained in both the main meeting room and in satellite rooms. Face masks or coverings will be required in accordance with Governor Baker's May 1, 2020 COVID-19 Order Number 31, order requiring face coverings in public where social distancing is not possible. A copy of that order can be found at mass.gov under Documents, the May 1st, 2020 Mask and Face Coverings download. Failure to comply with these requirements may lead to an attendee's removal from the meeting. Thank you. Okay. So, up right away on our agenda and on the phone, we have, hopefully, she'll be officially appointed this evening, our health agent. We have Jamie Terry. She's joining us via phone because she could not make it in person right now. So, Jamie, do you want to say hello?
Oh, no.
Do we still have you there?
Oh, boy.
Okay, so, hi. No, we understand. We kind of threw this on you. A week's notice is not easy to be able to pull everything together. So I know you do have your contract. I know you still are going to be reviewing it. You can turn the volume up if you want to. Okay. But what we'd like to do is we'd like to appoint you as our new health agent tonight, pending the approval of a contract between the Board of Health and yourself.
That would be wonderful. Thank you.
So I will entertain a motion.
Go ahead. I make a motion to appoint Jamie Terry as the Dudley Board of Health agent.
I second that motion.
Pending contract approval.
Pending contract approval.
I have a motion and a second. Any other discussion? Hearing none? All in favor?
Aye.
Aye. Passes unanimously. So welcome aboard, Jamie.
Welcome, Jamie.
Thank you very much.
So
Glad
up,
to be here.
thank you. Up next, we have 18 Norman Lane. It's a variance for septic and well. And let me see. So we received the plans and a letter from Green Hill Engineering. And on behalf of the homeowner, they're requesting approval for the following variances. I'm going to just read through the 4 variances that they're looking for. I know you each have copies of the maps. I'll have the engineer come up. I'm just going to read through, and then you can interject anything, and Jamie, you can interject whenever you're. So the variance that they're looking for is variance number 1, variance to 310 CMR 15.211. The proposed SAS does not meet the required setback from a well, 100 feet required, 80 feet provided, and that is for 16 Norman Lane. Second variance is the variance to 310 CMR 15.211. The proposed SAS does not meet the required setback from a well, 100 feet required, 80 feet provided, that is the owner. The variance to 310 CMR 15.211. The proposed SAS does not meet the required setback from a property line. 10 feet is required, 6 feet is provided, and that's for 85 Pierpont Road. And then the last variance is to 310 CMR 15.211. The proposed septic tank and pump chamber do not meet the required setback from a property line. 10 feet provided, 10 feet required, 6 feet provided. So everybody's looking at their prints, everything. Does any of the board have any questions at this time?
I think so.
Well, sounds like most of the lines are very close as far as meeting requirements.
Right.
So it's not gonna affect any structures or the
No.
well, compromise the wells. Seems pretty standard.
Jamie, what's your recommendation?
So I think this is a really tight lot. I've reviewed the plans. I think that this is the only option that this property has. It is certainly more protective than what's currently in the ground, and I recommend approval of this, these variance requests. Additionally, I just wanted to make note it's a 2-bedroom home, so it will need a 2-bedroom deed restriction.
Thank you. Okay. So I will entertain a motion.
So, you want to do variances 1 through 4 is listed? Okay. I make a motion to accept the variances 1 through 4 as listed. Given by Green Hill Engineering?
Yep.
For 18 Norman Lane variance for septic and well.
And
And then a 2-bedroom deed restriction.
I have a motion. Do I have a second?
You have a second.
Any other discussion on that?
Mm-mm.
Okay, seeing none, all in favor?
Aye.
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 Passes unanimously.
Thank you very much. You guys have a good evening.
Thank you so much. Okay, so up next is 239 Dudley Southbridge Road. I can have you guys.
Chairperson?
I'm sorry?
I said, Ms. Chairperson,
Yes.
I just wanted to say, I've already reviewed that plan too, and so tomorrow when I'm in the office, I'll hand it in to Michelle, but it's all set to be installed. I don't know if the property owner is there, but
Perfect.
I just wanted to give that approval information.
Thank you. Okay.
Welcome.
Okay, so we have 239 Dudley Southbridge Road, which we have Patricia and Paul. You can come forward to each of the microphones right there.
It's 237 Dudley Southbridge Road.
You're 237. You're 237.
237.
Right, I
Yes.
apologize.
And I'm Patricia, Paul. I just want to thank you for letting us attend the meeting. I know that we got a phone call this morning stating that you finally got a hold of Mr. McKinney. about the stack on his outdoor furnace, and he was not going to start it or fire it up until he puts the stack back on. Is that correct?
That is correct.
Okay, we were told that we didn't have to come to the meeting, but I feel like I want to voice my concerns about the outdoor furnace. We have lived in Dudley for 32 years, moved out of Worcester City to come into a town where we would live peacefully, healthfully, and enjoy our home. Since he put that outdoor furnace out there, we initially had problems. We ended up, I'm going to try and make my story short. We ended up in court several times, and the last time that we were in court for it, it was an understanding that he would not fire it up until November, and he would put a stack that is 2 feet above the peak of our house. When this all initially happened, prior to that, we lived around quite a few neighbors, and everybody got along. And when it started with Mr. McKinney with the furnace, we were no longer friendly. He harassed us. We put all new windows in to prevent the smell of the smoke to come into the house. We ended up having our house sided so we could seal it up more. Then we had to put up a fence, and all this work that we did, I would say it totaled to more than what his outdoor furnace cost. It was well $50,000 for everything. And he continued to harass us for a long period of time, but then it finally stopped. But then when he had to put up that stack 2 feet higher than the peak of our house, he started again. But we haven't been harassed or anything for quite a while. And the thing is, when all this first happened, I did a lot of research on outdoor furnaces, and wood-burning outdoor furnaces do release a lot of particles and pollutants, which cause chronic obstructive lung diseases, asthma, bronchitis, and emphysema. I have developed 2 nodules on one of my lungs since his furnace has been up and running. My doctor is presently monitoring them. I don't have any symptoms from that yet, but in the beginning with the Board of Health, we were getting nowhere with them. I feel that those outdoor furnaces should be in a rural area in an open land away from residential homes. There's quite a few residential homes around us. I don't know if anybody else has complained, but when his furnace is running, we get all the smoke coming over to our house because of the way the wind blows. I have 2 bedrooms on that side of the house that face the side of his, and my son can always, get the smell of the smoke, and I get it all the time. Years ago, we tried a wood-burning stove. It lasted for 1 season. It makes my eyes water, it gives me a sore throat and a dry throat, and it bothers me. And I don't think that Mr. McKinney thought of the health issues with the outdoor furnaces before he even, bought it and started it up, because he had to move it because it was close to our house, which he did. But there is one that he lives up the street from us, and it's not too far, but he lives in an open land space. Doesn't bother us, but we have it right next door to us. And I just don't think that it's fair that the Board of Health let him keep it and run it without any research on them, knowing that they are, whoever has one, it's a health issue to human beings. And it disturbs our rest. I mean, your home is supposed to be a place to be able to go home and be stress-free, rest, and be healthy. And since he started that, ours is far from that. So we're anticipating the start of it in November, and I feel that if he doesn't have that stack up, you will definitely hear from me again. I'm a nurse. I know what the health issues with this. Like I said, I researched it when it first came about. And there was only one person from the Board of Health that had him deceased, the firing up of it. And she wasn't, she was leaving the Board of Health, not far from that time. And once she was not the nurse of the Board of Health anymore, they let him just go to town with it. So, I mean, we have exhausted all venues regarding this outdoor furnace. And to me, it seems like nobody is really cares or is concerned about other people's health. So I just wanted to come here tonight to tell you what my concerns are. And hopefully he'll put that high stack up, but I still don't approve of it. They don't belong in residential areas. They belong in a rural area where it's all open ground and nobody is around them. So, I mean, we've fought this tooth and nail, but it just never, nobody ever really helped us out. We did go to a lawyer once, but if he took our case, we went to a couple, it would have cost us thousands and thousands of dollars. But if it ever gets to that point, I would use all my savings just to get rid of that furnace away from us. I mean, we've been living on 237 Dudley, Southbridge Road for 32 years. And like I said, all the neighbors get along. And I don't know if anybody else around us has complained about it, but the woman in back of us that lives in back of us, she does have asthma. But I'm concerned about what the doctor detected on my lung. And that was, I want to say about 5 years ago, but now I have another one. So, and I don't smoke. Nobody in our household smokes.
Okay.
And that's all I wanted to say.
Okay.
I just wanted you to know our concerns.
Yes, absolutely. Thank you. My health agent would like to ask a question, so go ahead, Jamie. Oh, is it you? Oh, sorry. I'm sorry. I apologize, Jamie. It wasn't you. I'm sorry. It was Lori. You both came from the same direction. I apologize. Go ahead, Lori.
Thank you for sharing that. I could completely understand how it's affected your lives. How long ago did he put the furnace in, did you say?
Oh, I'd say it's at least 12 years.
Yeah, they started a while back. I wanted to say something.
Yeah, I was going to let you. I was just...
I just finished with her.
Yeah, absolutely.
I think it's about maybe 12 years.
12 years ago.
I mean, time goes by so fast, but, we did go to the Dudley courts at least 3 times.
Wow. And Jen, this question, is there a zoning variance? Is anything currently in place for these outdoor fireplaces?
Let me just give you a little...
Catch me up.
The state of Mass has outdoor boiler regulations, which is what we follow. We follow exactly what the state of Mass puts out. There is zoning where they're located. They're in the residential 87, which is our biggest zoning district. And they are allowed, because that is considered I understand what you're saying completely, but according to our zoning, it's considered a rural residential area. That is our largest zoning district. That's where most of your items are allowed.
Do we know in general, like, how many others are in town that are in similar
Yeah.
areas like that, that aren't where rural, I know somebody who has one, and they're in a very rural,
Right.
and it doesn't bother the neighbors.
There are, I'm trying to think, there are more throughout the town. Off
Can
the
I-
top, I apologize, I don't
No,
know
it's all right. I
exactly,
mean,
but
I'm
I do
throwing
know of
stuff
some
that-
that are, you know,
Just
Can
out of
I interrupt?
curiosity.
Most towns in Massachusetts banned them. They don't even let their town residents have them. And I researched that in the
and
past.
I have heard that, but what you have to understand is if we did decide to ban them, they are already here.
Right.
So there would be nothing that we could do regarding that.
Well, I understand that the ones that are present were waived in, but I think health concerns are more important than heating your house. I mean, there's other means to heat your home than smoking a family out of their house. And, you know, I dread winters.
No,
I really do.
I mean,
If
in
I could wrap my
comparison-
house in a bubble, I would do that, but we can't.
Right.
But it bothers my son too. I mean, he wakes up in the middle of the night because he smells it and it bothers him.
I mean, in
No,
comparison to a
and-
wood stove,
But
is
I
it the same
understand.
amount of, particles and dust?
Well,
I
it
mean, I burned a
does.
wood stove for years. So
Wood
you
bur-
use that smell.
Wood burning releases particles and pollutants.
Mhm.
And another thing that I wanted to mention, since he's had that furnace, he doesn't have rubbish pickup anymore either. The rubbish barrels
You know,
were gone.
it burns it.
And I can't prove that he burns rubbish,
Right.
but where is the rubbish going? That'd be like us taking a barrel and put it in the backyard and start burning our rubbish so we didn't have to pay to have it picked up or pay for a town sticker for our vehicles.
Mhm.
Oh, I had read something. Jamie, are you there?
Yes, I'm here, and it is 12 years. He had installed it 12 years ago.
Okay. Is there anything that you would like to add?
So I relate to the people that are there. I'm having a little bit of a hard time hearing them, but I relate to what they're saying. I have asthma. I understand the sensitivity of smoke. It's just we are bound by the regulations that Massachusetts put out for outdoor wood boilers. It is not a lot of towns that ban them. There are towns that banned them prior to Mass putting regs in effect, and I want to say the regs went into effect in 2010 or somewhere there right around. But again, not a lot of towns banned them. Some towns put a moratorium so that they couldn't go in until the regs went into effect. But we're bound by the regs that the state put out.
Okay, thank you. Roberta, do you have any questions?
Maybe I just can't hear it correctly. Did you say a stack? Is it like a chimney that they have to
Yeah,
put
it's
up
like a
top?
big pipe.
Okay. So if they put that on, then the smoke won't blow closer to your house? It'll
Well,
go up
it
higher?
does, but it's not as bad.
Okay. Got it.
You know, we
okay.
can still smell it and it
And he
irritates
hasn't
me.
put that on, he has not put that
He
in
has
yet?
not put that on.
Okay.
And I believe that
The,
you
the
notified
screws
the board.
rusted out. It dropped down in height because the screws rusted out, and he has the parts, but he hasn't installed them yet.
Okay.
And he isn't intending on using it until he's back in compliance.
I don't know what she said.
She said that the screws rusted out, and that's why it fell down. He does have the parts, but he hasn't had the chance to repair it yet, and he does not intend on using it until it has been repaired
And in compliance.
in compliance. So that being said, if the stack doesn't go back up to where it was and he does start burning, by all means, let us know immediately,
Okay.
okay? Absolutely. And I apologize, did you want to add anything else? I was coming back to you. I didn't forget about you.
No. The stack's gotta go up, but there's gotta be another 4-inch pipe on top of that to be legal, to over the roof. That piece, I guess, rotted off, and
Okay.
he never replaced it. But it didn't, affected us that bad.
Okay.
And I believe what he's been burning over the years contributed to my cancer.
I know my husband had cancer twice, and it was all in his sinuses,
I had non-Hodgkin's
non-Hodgkin's cancer,
lymphoma.
yeah.
Um,
So,
As I kept breathing all that. He burned plastic a lot. Because
Okay.
he has a molding shop or something.
I know
It's got
sometimes
plastic.
sometimes you can smell like chemicals.
Sulfur.
Sulfur.
Oh,
You smell sulfur.
So Jamie, will you, when you speak with him again, will you remind him and reconfirm what he's allowed to burn in there? I know we did a couple years ago, or a few years ago, there was information relayed to him as to what he was allowed to burn in there. Nothing but clean wood that's untreated, no paint, no stain, no trash, nothing of that nature. But would you be able to speak with him again in the future regarding that?
Sure.
Thank you. So basically, I guess we'll stay on top of this. Please call into the Board of Health if at any time prior to it going back up, as it should be, but back into compliance, if he starts to burn it, call us.
Okay,
Call in, you'll reach Michelle.
okay,
She'll take the information right away. She'll get in touch with our health agent. She'll keep the board informed as well,
okay.
okay?
Yeah, sounds fair.
Yeah, and, you know, and even, let's say if, we'll say a month from now, everything's going halfway well.
Yes,
Just
Yep.
keep us informed.
I
Just let us
will.
know that
I will.
things are, you know, going okay or things aren't going okay.
All right. On that side of the house, I even put up plastic. And I mean, nobody should have to do that. We
Right.
have, our house is well maintained. We have good windows and everything. And then I have to put plastic up to try and avoid it from coming into the bedrooms. So it's just, well, you understand what I'm
I
saying.
do
Oh, yeah,
understand.
That's another question.
Yeah.
Certainly.
I thought a cease was permanent.
I'm so sorry?
A cease on the furnace, is that permanent? Or it's, no?
No,
Okay.
no. It's just till it's back in compliance.
All right.
Okay.
Okay?
I don't have anything
Nothing
else
else.
to say.
No problem. At any time, feel free to call. Thank you.
Thank you very much for letting me
Yep.
Thank you.
Thanks.
voice my concerns. Thank you.
You're welcome.
Okay, up next, number 5 is the library reopening plan submission. So, Jamie, do you have, Michelle, did you get Jamie a copy of that? The library reopening plan?
Yeah, I have a copy. I
Okay.
think you gave it to me, Jen, when I was there.
Okay, Sorry.
I think it came from, yeah, that's okay. I think it came from Mr. Ruda. And, so I looked at it, I reviewed it. I don't have any concerns about what they proposed. It looks like they read through the guidance that the state put out, and, they are moving forward in that direction. It starts with what we need: plexiglass screens built for circulation desks, furniture moved, and large signage printed. I imagine that's not the health department's responsibility to do.
Right.
But what they're proposing for the plan is perfectly in line with what I think it should be.
Okay. So we do have Drusilla, she's the head of the library here with us. Do you have any questions for us?
No, I don't think so. Just, you know, to point out that this is, we are kind of lucky in a way that so many other libraries have already started opening, so we've been able to kind of see what works for them and what doesn't. But we've all, you know, and I've made sure that the library staff are aware that this could change and there could be new guidelines that come out that we'll have to adapt, or, you know, we could all have to shut down again and go back. So we're kind of treating this as a template, but a work in progress as best practices come out.
Okay. Do you have any idea as to when you're thinking of or aiming to reopen?
Rumor has it that the plexiglass will start being built next week. Of course, if you've been in the library, our 2 circulation desks are extremely large. So it's not going to be, you know, just put up a couple of screens. This is probably going to be quite a big project for him. The signage, we're very lucky we have a graphic designer on our library board, so she has the signage, it's gone to the printer. But it's gonna depend on when we get all of the steps kind of in place. You know, Mr. Ruda had said that he was gonna send some of the guys from the highway department to move furniture. And I don't wanna open the doors when we still have, you know, comfy chairs and couches around. We want those gone, so as not to confuse anyone or encourage anyone to linger. So we're kind of hoping by the middle of November if everything goes smoothly and everything is in place, but again, we're kind of playing by ear to see how things, you know, make sure everything is in place before we set a date to open.
Okay. I think everything looks good. I would say just keep us informed and give us, you know, a heads up when you think you're going to be opening, and we'll just.
Yeah, like I said, tentative right now, if everything goes according to plan, would be the middle of November.
I just had one question.
Absolutely.
The limit.
Would you mind just, oh, I'm sorry.
Go ahead.
Go ahead, Jamie.
I was just going to say, would you mind just sharing my cell phone number with her so that when she might come across a scenario that she needs some guidance, she can have direct access to get to me quickly?
Yeah,
Absolutely. I'll have Michelle give it to her.
Yeah, that would be great, because we're lucky that we've got folks at the Mass Board of Library Commissioners that are on top of it and that we can contact for kind of best practices from their end, but they also recognize that every community is different, so you know, what works for some other libraries may not quite work for us.
I guess I was just wondering, the last bulleted point that said limit 2 families in the children's department, is that like on sign up, or once there's 2 there, the front desk staff are gonna be like, sorry, we're at capacity?
We actually have doors into the children's department that close, so we can kind of close that area off. And was talking with the children's librarian and kind of what best practices are in other libraries. You know, we're not encouraging people to linger, so what we're asking is, you know, we don't want 17 small children running around the children's department at once, so go in, get your books, take them back out to the main circulation desk, and let another family go in. So we're kind of hoping that we can do it, just come in and go without people having to make appointments, but the possibility of making appointments, you know, that's one of the things that we may have to do.
Right.
But we're hoping most of our patrons, you know, they know what section of books they're going to, and they, you know, they can kind of go in and grab and go out again, so.
Okay.
Mindful. Sure, people will be mindful of all that, you know.
Right.
You know, and there's obviously the toys are gonna be gone, and the comfy places to sit are gonna be gone, and the, under children's department where it says AWE computers, those are the computers that are not text-based, they're picture-based for the littlest ones. And they encourage kids to sit and do like learning games. Well, those won't be there at all, so.
It's just basically get the books.
Get your books and, you know, and it'll be the same for the adult department. Get your things and, you know, find what you want and head out again.
Yeah. You still, videos, like the DVDs, are those still allowed? They can rent those too, so DVDs, the books.
Yeah, and we are getting delivery. We've been getting delivery since June. So, you know, our curbside pickup's going on right now. So, you know, we'll still be getting delivery in and out and everything. It goes through the warehouse. It goes through a warehouse process. So it's essentially in quarantine for like 3 days with nobody touching it before it comes to us. So thank heavens we kind of deal with that. But so anything, you know, again, anything that we don't have, people can request and we will provide that. But all of our materials, and again, you know, we're for right now planning that like the board books, which are for the littlest ones, we're still going to circulate, but we're going to keep an eye on that. And if they're, which our patrons tend to be fabulous, but if we're getting them back covered in like baby spit up or something, then we might have to just put that section out of circulation for a while.
Yeah. Make adjustments as you need
Yeah,
to.
exactly.
Yeah,
and, you know, kind of, we kind of understand we're going to have to play it by ear because we'll have to see what happens once the doors open.
Okay, great. Thank you very much.
Okay.
Yeah, we're excited,
Yes.
We are,
I bet.
it's so weird for librarians not to have anyone in the building. It's just so strange for us. We are so excited that we're finally going to have people back.
And kudos, by the way, for the Scarecrow contest. I mean, thank you for organizing. I don't know who, if it was only the library organizing all that, but I think it was great. I think it got How many actual?
We had 35 or 36,
That's
I can't
awesome.
remember. We should be announcing the winners tomorrow. We did our judging and kind of.
Some people had some really cool ideas.
There were some
Really
really
cool.
great
Oh, it
ones.
was
Really great.
Yeah. So if anybody out there listening has not driven around and gone to see them all, it's kind of fun to go see, you know,
Absolutely.
the different. My personal favorite is the one that appears, we couldn't tell if it was deliberate or not, but it looks like the scarecrow has been hit in the back with an arrow and has keeled over. I kind of liked that one. There's like a body on the lawn.
Oh, my gosh.
Very nice, I
Love
like
it.
that.
Yeah, they were great. They were really good.
Yeah,
Thank
and I
you
mean,
very
it was
much.
great to see the creativity in
Mhm.
Dudley, so that was nice.
Great, thank you.
Thank
All right, you're
you.
welcome.
Thank you.
Okay, up next will be Roberta, COVID update.
I'll lump my 3 together.
You can have it all right now, yes.
Right. So COVID cases right now, we have 3. I just haven't sent my update, sorry. So we have 3 out of the 5, so that's excellent. I want to also just talk a little bit about the flu clinic, if that's okay.
Absolutely.
So November 5th, there's going to be a staff for the teachers at Charlton and Dudley, November 5th, 11:30 to 5:30, Shepherd Hill and Charlton Middle School. So they're going to be inside. I believe Charlton Middle School is in the conference room and Shepherd Hill is the library. I'm not 100%, but they are inside, and there are some, CVS is hosting it, and it's every 15-minute slots that staff can sign up for. And then Dudley and Charlton Board of Health are having a family flu clinic on November 7th up at Shepherd Hill from 9 to 12. So any child that goes to the school and their families, so we're gonna have vaccines for both. Right now, we're planning for a drive-through, but the weather has been kind of uncooperative, so it might be a little bit cold to have that outside, so we're gonna plan and practice to do set up for outside, set up for inside, and kind of see which way we go. I'm working on trying to get a flu clinic for town employees, but I've kind of hit a brick wall just because there's some requirements that I, have to meet, and right now we're not quite there yet. So, and there's a little bit of phone tag with a couple of people, so I'm trying to get that done too. So, I think we'll try to get as many people vaccinated as we can, which is, as we all know, DPH said now it has to be mandatory by the end of the year for children up to 18 and college students, I believe.
Yes.
So we're trying to get that squared away, try to help the families out a little bit. So, we'll see what we could come out of that. Out of the, last I asked one of the girls, they checked the sign up for the flu clinic, and we were at capacity for 150, and then Jamie added some more slots, and the last I looked, which was yesterday, we were at 160 slots. So we're filling up. I still have heard from some of my families that they didn't know we were doing a flu clinic, so I had my principal put the letter out again, and I know the other girls at all the other schools are doing a really good job about posting it and posting it and posting it. So hopefully we can get the word out there.
Great.
So that's really it. Everyone's doing a good job about social distancing and masks, and it's getting kind of monotonous, but we have to keep doing it because we're going into the cold months, so
Right.
fingers crossed that will be okay.
We're back in school.
We are back in school. We're we're at 2 days a week at my school. Actually, all the schools, cohort B, cohort A, cohort B, and then kids who are in cohort C go every day. Nobody goes on Wednesdays because they do deep cleaning on Wednesdays. So it seems to be going okay.
Good.
Knock on wood.
Yeah.
Kids seem happy.
Bet.
So good to see them all. It's hard to recognize them because they have their mask on, and I'm like, what? I don't know who you are. I don't know you just by your eyeballs. But so far, it seems to be working out okay.
Good.
So,
Okay, thank you.
you're welcome.
Thanks, Ro.
So next I'll
Welcome.
move on to Jamie. This would be where we would have you do our health agent report, anything, comments or anything. Do you have anything for us?
I'm not really sure what you're looking for, but I have 2 housing inspections tomorrow. I have, there was a property in town that I got a call about last week that there was raw sewage breaking out to ground surface. I went out there, I verified it. Today I reached the owner of the property, and I'm expecting a call back this evening as the resolution to that begins. I will create an order letter, but I was trying to reach him and verbally explain it to him and go over it with him first, so I did, and I feel like it was a successful call.
Great.
And then I've reviewed plans for 322 Mason Road Extension and approved them for a new septic system there. I wanted to ask you about local upgrade approvals. I know some communities allow their health agent to approve local upgrade approvals outside of a meeting. I don't know how you
Yes.
feel about that.
Yes.
I don't know what that is.
So Tom used to do, basically, it's when they're looking for just a local upgrade approval, not like a variance or anything like that. And the Board of Health used to give Tom the authority to do that, rather than having them come to a meeting delaying them.
Oh, got it.
So is that something that we're still comfortable with
Yeah,
having?
yeah,
I
yeah,
have no problem with it, no.
That's, so there's no changes to a variance?
No.
I feel like.
No, it's just local upgrade
Yeah.
approval. So you're good with that?
Okay, so then I also have reviewed 8 Jean Street in Dudley. I have a question that I want them to show where the water line is, but
Okay.
I'll expect them to do that when I let them know. And that does have local upgrade approvals, but they're standard, and I think that they're fine. I also reviewed a plan for 32 Quinnebog Road in Dudley. Again, that has local upgrade approvals that I think are standard on that as well. I don't have any problems with that. I think that's all I had, because the other one I had was that one we talked about earlier that was Mark Farrell's plan that I looked at and was
Right.
fine. And I told you already that I had reviewed it and I was fine with that. So that's it. I think I'm up to date on all of the paperwork you gave me last week to get us caught up from after Tom left, and I think that I think we're in good shape.
Excellent, thank you, and I know we threw a lot at you, and you've, hit the ground running for sure, and then some. So we appreciate
thanks.
everything.
I think that's just kind of how it goes, right?
Yeah, unfortunately, and come aboard during a pandemic too, we'll make it real fun, right?
Yeah. It's always good to work with a good team.
Well, thank you, we hope, we're happy to have you and very excited about this. All right, so next.
I'm happy to be here.
Oh, thank you. So, Ro already did her board member comments.
Mm-hmm.
Lori, do you have any board member comments you'd like to entertain?
I do not.
Okay. Before I go on to board member, I have a few things just to touch base with. We need to approve the minutes from September 24th meeting.
I make a motion to approve the minutes from the September 24th, 2020 meeting.
Accept.
I have a motion and a second.
Knocked it over.
Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously. So under my board member comments, we were just recently approached about the, Webster, I'll come back to it, don't
Okay,
worry.
thank you.
The Webster Dudley Boys Club doing a toll booth. We had allowed a toll booth a few months back. They do a socially distanced toll booth where they use like the long baskets and the cars drive by,
Oh,
they're
yep.
wearing masks, people are socially distanced. So, Mr. Ruda was just looking to make sure that it was still okay that they continue authorizing these socially distanced toll booths. And like, I feel that as long as they're not on top of each other,
Right.
it's
They're
the
not
best.
receiving the money by hand.
Exactly, they're
Yeah.
using a basket, something with a longer handle.
Right.
And in this time, it's the best fundraiser that a lot of places can do
Exactly.
due to everything with COVID, so.
Exactly.
All right, I just wanted to make sure we were still on board with that. I wanted to remind everyone that Tuesday is voting. Tomorrow is the last day that you can come and early vote between the hours of 9 and 12 at the town hall. And then it will be from 7 a.m. until 8 p.m. on Tuesday, November 3rd, here at the town hall. So if you haven't voted by mail or early, come on down on the 3rd. We've made sure, Ro and I have both been working with the town clerk, making sure that, just like the previous elections, everything will be working the same way. everyone that will have our nice little plexiglass and masks and hand sanitizer, and you need to, in order to come in, you need to have a mask on. If you have a medical, when you get in, please contact someone, because we do have a spot for people without masks to be able to vote, so that we're limiting their exposure as well. So, but I think voting the last two
It
times
seems to
have
be
gone
going
very
fine,
well.
yeah.
So
Yep,
Mm-hmm.
look
Very-
forward to it.
done very well.
Yep.
So that, and then my next question, then I throw it back to you, is when is our November meeting? I don't think we had
We
one.
made one because it's Thanksgiving.
We need to have one in November, because there's a possibility or probability we won't be meeting in December.
Okay, yeah, I don't think we talked about November,
No,
did
because we weren't sure what your school schedule, if you were
Oh.
gonna have classes or not.
I have November 17th written down, but that might have been old because it still says 6:30, right?
Yeah.
Yeah.
Yeah, that might be an old one.
That was-
But I am
My
available.
calendar says you guys have a meeting on the 19th of November.
Okay, what time does that one say?
Sorry, I had to look, 4:30.
Okay,
30?
I could do
Okay.
that.
can you do that?
Yep.
Okay, so that's what we're gonna go with. I just wanted to make sure we all knew, because we've had to change some for availability, so it'll be November 19th at 4:30. Because I don't think, unless something horrible happens, that we'll be meeting in December, just from things that are going on. And then, I just wanna say, our COVID numbers are down, things are well. We did have 1 week where we were in the red, but we went back to yellow. Things are good. Everybody's doing what they should be doing, hopefully. And if you do choose to go trick-or-treating this week, this Saturday night, please practice social distancing. Please take care of yourself and protect yourself, and wear a mask.
Under your mask, right? Yeah.
I know. Please protect yourself, definitely think about that.
And be mindful of the people that do not want to participate.
That's right. If there's not a light
Oh,
on.
right, yeah, if there's no
Is
light
it
on,
go,
yeah.
or if there's a sign there, respect that they don't want to have anyone around.
Mhm.
Lori?
I'm just, maybe the chickens? No?
We'll have
Okay.
to do some digging,
Okay.
yeah. Okay. So, anybody have anything else?
I'm good then.
No. I was just looking at my
Okay.
date.
So if that's everything, I will entertain a motion.
Make a motion to adjourn.
I second.
I have a motion and a second. Seeing no other discussion, all in favor?
Aye.
Aye. Meeting closed at 5:22 PM.
Ba-bum.